Yeah, I think it's trust is earned, right? But if you start with a premise that that's what you want, then you're going to approach something different than if you start with a premise that you don't even care.
Or don't know about it. Don't know that it's important.
Yeah.
Yeah,
Or don't
understand.
know it. That's even a better point. Yeah, if you don't even know trust is important, then you're not going after it.
Mm-hmm.
Yeah, so true that. Yes.
Mm-hmm. Mm-hmm. So, you mentioned COVID earlier. It seemed like COVID shined a bright light on what we're talking about here, right? Because the folks that suffered in your county, my county as well, Prince George's County, where I spent
Hmm.
a lot of time and lived for a number of years, um, COVID COVID was a direct result, not in every case, but in many cases, of folks not having preventative care. As you said earlier, not even having a decent store to go shopping for food. So all these what they call predisposing factors, social determinants of health issues that have been building up for years and years because people weren't doing what they were supposed to do because they didn't have a trusted resource. So it all built up. COVID strikes, and then of course the virus goes after what the weaker folks in the community.
Yeah.
And Prince George's County was devastated. So maybe that is a beacon. Is that a shining light on? This is what I'm getting to. Is this time going to be different? Because you and I, we lived through Rodney King. We lived through other. I'm not that old to be through the 60s, but there were other times in our society where, there was this reckoning. Do you think now is the time where we're finally at that point where we can get some real work done based on what we've talked about here? Trust, diversity, equity, and inclusion. Do you think this time's different?
I think, yeah, I think there's an opportunity now for a movement, so to speak. Well, I think there are already movements coming out of the George Floyd situation and what we saw going on across this country. You can see the bias just setting itself up in terms of the factions that, believed it was right and those that believed it was wrong. But certainly many more believed that it was wrong than believed it was right. And as a result, there's all kind of movement. So yeah, I think it's a perfect time to educate all of America around what the inequities are. You're doing health, I'm doing business. And so we're in a similar space. And I think there's parallels between the two. We have small businesses not getting access to loans. And if they can't get access to loans, they don't have a line of credit. Their ability to fund jobs when they're being paid over 120 days shrinks because they don't have access to capital. And so you see JP Morgans of the world, you see Citibanks all working on creating, changing lending rules so that they can create opportunities for those small businesses and understanding what their challenges are with respect to credit and taxes and any of the other issues that are impediments to them getting loans.